Right? So we're going to move from that conversation to our next conversation. One of our themes that you hear quite often is sustainability. So I'm going to welcome to the stage our next guest, which is actually a panel of guys standing here. So ready to come on stage. You guys are ready? Come on up, CEO Ahmed Omar. Abdel Rahman Ahmed Omar, excuse me. Come on up. Give him a round of applause. CEO, he is our main sponsor, the Burjeel Hospital Silver sponsor. Great to have you here. I'll let you take it away. All right? You've been waiting. I see. I leave. Okay, bye-bye.
It's sustainability, I guess, and we need to keep you sustainably awake. After some lunch, I've seen that people start to settle down, and since we spoke to each other in the morning, a lot of people are having some jet lag or just arrived today and things. So we tried to make it a little bit more full of actions. Okay, I have a fantastic panel here. Lovely people. I've got 3 medical doctors originally. One, a genius scientist, and one is a guru who can affect the media and the public. So it's quite an exciting group of people here. Sorry. So Reijiro, Hashimoto, come in. Mr. Pattnaik, come. Mr. Artico. Dr. Artico, sorry, double doctors. And Vikas, and Dr. Yves. He's a cardiologist by trade, and we have an orthopedic surgeon, and I happen to be a colorectal surgeon before going to management. Mr. Hashimoto, can you just give everyone, please, just give a background about yourselves?
Everyone has a microphone. I want to make sure everyone has a mic so we could hear you all the way in the back.
Okay. Yes. It's my turn. Okay, hello everyone. My name is Reijiro Hashimoto from Japan. I'm a CEO of the Medicolle Inc. And we are providing the content check system for medical and healthcare industry and media industry. So we are checking the content, whether or not this content is safe to view by SAARC and doctors. And I worked for Japanese television, and at the time I'm gathering the data of the healthcare and healthcare system. So today is really exciting to talk about the sustainability of the healthcare system. Thank you, man.
It's a great chance that somebody like him here, because of exposure to the world. He traveled the world during COVID, been in different places, and mainly also from Japan, which is a very exciting health system that's different to the rest of the world. There is a lot of equality and hitchhiking, the rich and the poor. So his reflection will be quite helpful. And now to my friend here, Pattnaik.
Yeah, as good afternoon. I think myself, Tusar Pattnaik, and I'm from a factory backgrounds, the FMCG company called Dabur India Limited. And I have more than 23 years of experience in the field of health, safety, environment, and sustainability. The doctors and rest of the people will come later. Before going to the doctor, how to the environment make it more friendly. So that is my job. So after that, again comes into picture of the take care of the sustainability of the healthcare system. So working in this profession very passionately for last 23 years and doing a lot of jobs in terms of COVID by taking care of the health of the employees and many of the things. So after the later on discussion, we'll talk about more things. Thank you.
Pattnaik is also known as the king of plastic recycling. So I don't know how he's going to recycle our health system and make it sustainable. We're going to see things, right? Oh, Dr. Artico.
Hey, hi. Nice everybody. I'm Fausto. I have multiple masters, PhDs. My background is the one of mathematician and computer scientist. Work in Silicon Valley, IBM Digital Research Center, New York. And after I moved to pharma to help people in a different way, pharma was a completely cultural shock. So today, where I can add value with those other amazing people is to try to explain to you what I noticed could make healthcare systems much more resilient, considering that I'm an outsider. And that is essentially where I hope we can have a discussion. So thank you very much for inviting me today.
Good, thank you. And now for our cardiologists who just like caught up with us late a little bit. So you're going to tell us about your background. I know that you're a cardiologist, invasive cardiologist, but for everybody to know, and how you link to sustainability in healthcare.
Okay, so it's related to the previous talk. I was a cardiologist working in a cath lab. After 5,000, I was completely burnt out. How I was burnt out, somebody entered and asked me, "What's the name of the patient?" And I said, "I don't know." I became part of the machine. So I left. And I decided to do something which is missing to everybody: impact. I built a company. The company is now a hospital at home in Israel. We are serving every day about 2,000 people all over the country: acute patient, chronic patient, acute psychiatry, everything at home. Instead of people going to the hospital is coming to their home. This is sustainability. Nobody has to drive to the hospital. Nobody has to stay there. The outcome, believe me, are much better. Why? Because the paradigm of medicine is changing. We are treating now chronic disease for many years. In the past, it was 2, 3, 5 years until the patient died. Now we can live 30, 40 years. And the hospital are not the answer for that. The community is the answer, and that's what we're doing. We're developing telemedicine, we're developing digital health, and we're using as tools to monitor and to treat people at home, but also every day somebody knocks on the door and the human factor touch the patient. That's what I do.
Great, great to hear that from somebody from Israel, where there is a renowned, excellent health system, one of the best in the region and in the world. We used to take it as a hub for training, as well as a startup ideas and innovation. And now I can hear that there is an idea of changing the whole system. So Rampam and Sheba are gonna go, are they? Right. Now we have our doctor there, Vikas, Jain, sorry. Vikas is a fellow surgeon. He's an orthopod. We're going to see what Bond Doctor going to say now.
Thank you, Dr. Ahmed. A very good afternoon to all of you. I come from India. I'm an orthopedic surgeon. However, that's only an orthopedic surgeon by profession. Healthcare management, being an MBA into healthcare, makes me more passionate about healthcare management, because I got to learn that if I remain a surgeon and remain myself into an operation theater, probably I'll not be able to work for the people, for all the gaps that I have understood that exist in the healthcare system. And that's exactly why we are here, to understand the healthcare sustainability. I'm also a 3D technology expert, a digital healthcare mentor for a lot of startups in India, and into corporate finance, where I'm into private equity investment. That's a small biodata that I have.
Yeah, that's good. So he left Bones long way. All right. I mean, like, it's going to be quite exciting discussion. It's going to be most of it open-ended things to see how each one of them come with an idea and represent how to solve the problem. Because sustainability of healthcare is not an easy thing. It is something that's challenging, and we have to find a solution before 2030. That's our deadline. I mean, one of the most important things that have some experience in the NHS, as well as India, for example, Apollo, the United States, Japan, Far East, always there is a challenge about money. Where does the money come from? How can we sustain the supply of money? I believe that I can ask somebody here who's going to tell us about that. Whom of you is going to be talking about the finance?
That's me.
Yeah, that's you. Yes, exactly.
Okay. So one of the things that I noticed coming from outside pharma is there are not really the right financial incentives to put in place a sustainable healthcare ecosystem. Some of you are pursuing a plan for 2070, if I understood correctly.
Yes.
Right? And my experience is it's a very complex, multi-side market. It's not anymore business to consumer, it's business to business to business to business to consumer. And furthermore, it's not a linear thing, it's more like a graph. So how you make that sustainable, at least from the financial point of view? Well, the right incentive system is integrated insurances with government and so on, but also the financial aspect of that system from banking is important. I would cure my son, if I would have one, especially if he has a rare disease, and instead of buying an house, I put all the money that the bank can loan to me to cure my son and pay back in 40 years. Today, I still do not see those kind of tools in place. So that is a way of doing things. Another way of doing things is, and I don't know why they are not doing it, but it's not really a regulatory problem. It's more the fact that the financial instruments are not there too, and somebody simply needs to create them. Why we don't all pool some money, and after, doesn't matter who is going to get sick, that person gets cured, right? That is another way of doing things for the risk of the process. So there are some aspects from portfolio management on how you can de-risk things that today are not used in pharma. And banking is still not very happy to put them in place because maybe they don't have the right background, or if something is happening to me and I'm going to die, who is going to pay the loan for my son? But tomorrow with emerging technologies, we can speak more. Those things can be taken care of, and it's more a kind of coming together to just discuss what could look like those kind of financial incentives and instruments that we need to create, because really we already have all the pieces. They are simply not connected in the right way, and I don't know why people sometimes and our institutions are overlooking this aspect. That is the financial one. There are other aspects we can speak more later about the other aspects, but those are just some ideas. And maybe here in Saudi Arabia, we can do something that not even in US is still present, because from rare diseases that require one payment off to more long-term cures, all those things can really be the risk to bring to the masses, and especially to people that cannot pay today for cures, the cures that they need in ways that can be essentially amortized across the whole population.
Yeah. I mean, it's going to be a bit of a big challenge. There is so many systems that can finance the healthcare. There is compulsory ones. Could it be the state? Is it private sector? Is it insurance related? Is it a private-public partnership? Is it just printing blockchains and doing things? And
well, so I had the opportunity to discuss with some people at the MIT, right, that are working on those things. And they were saying, really, the major block and resistance is due to the fact that nobody ever did those things, and they don't know how they are going to work out if sometimes it's happening to you. So the reality is the risk aversion that pharma has, especially as you were describing, highly regulated and complex environment that have a lot of legacy systems, that is making the situation difficult. But I think that, and I think too, as soon as somebody takes the lead and somebody takes that leap to make possible for some people to pay for cures in much longer term, amortizing costs, the better will be for everybody, because everybody else will follow. So it's always this kind of dynamic where who is going to be the first to take the risk.
oh,
It's that one really. Doesn't matter if it comes from the private sector or the government, it's more who is
somebody
going to
gets the money, right? I mean, sometimes when you have challenges, we go back to basics. What's the cause of trying to get treatment or health needs? In that stage, I'm going to go to Mr. Pattnaik here, who is health and safety officer. He got some interest in environmental impact on health systems. I mean, how can we go the other way around? How could the environment make our healthcare system sustainable? If we look after the environment, are we going to look after health and make it sustainable, or the other way around?
The topic is sustainability of the healthcare system. If you are talking about sustainability of any system, it lies on the 4 factors. First is on the environment. Second, as I already talked about, economical. Third is about your social. And fourth is your system stability. So the 4th factor, system stability of the healthcare system. You know, in my left-hand side and right-hand side, doctors, experts, scientists, everybody is sitting here. So when we're talking about healthcare system, when patient has on that condition, going to the hospital. Doctor is there to treat it. Technology is there. Everybody is there. But I am, as a health and safety professional working in this field of 23 years, I'll mostly focus on how environment will reduce your healthcare system in the more easy level. Because when you're talking about environment, because when a healthcare system will be more, I think, strengthened, that means from the environment point of view, this environment we are living, this environment we are eating, the lifestyle we are maintaining, this all depends on your entire environment. If you're talking about, I'm from India, the people are largely population, and it's a high pollutions in terms of water pollution, in terms of waste pollution, in terms of plastic waste pollution, a lot of pollution around that. And the water contaminated to the ground, and the people are cultivated the vegetables in the ground, and that's eating into the body. That's affecting your health system. And after affecting that health system and going to hospital for the healthcare system. So why before going to the hospital, why not you take care of the first environment, which is the root cause for the sustainability of any things. So we should eat good food, good lifestyle, good healthy, and so that we should minimize the kinds of hazards effect in the environment so that the healthcare system will be sustainable. Because if you think during the pandemic, the entire world has been crashed. So no system has been properly worked. Because for that, from the beginning of the stage, people has to learn and educate from the school level in education, how to make the environment friendly. So how to take, what is the water you are drinking, that should be free of contaminated. You should not get contaminated water during the food. Otherwise, a lot of materials is going into your body, and a lot of diseases will occur. So that's the main point, is to take care of the environment first and make a healthy lifestyle and make your fit yourself, so that when you'll go to the healthcare system and the other part, definitely the technology and doctor, rest of the part, they'll touch up. So that's the basically I'm focusing about. Firstly, you have to protect your environment with a lot of measures. Without taking the lot of measures in the environment, if we are thinking about that, how robust is our healthcare system, whether government will support or the public-private partnership, it will up to exist in certain times. But before to that, what is the pre-actions to be taken? That is to be action taken about the environment. Unless you protect our environment, in the next 50 years, you know what will going to be happen in the world. A lot of glacier is melting and everything, a lot of temperature is going and going. So in spite of your highest technology and healthcare system, it will not work till the environment is free of hazards.
Oh, thank you. But just like mainly, this is going to come to a second question. Because if you look at our health care system, it's not only a hospital. Pharmaceuticals, all right? They are the highest polluting industry for water ever. Hospitals are the highest consumers of plastic per inch, all right? So disposable. And the toxins, the highest toxins available easily in close to the public are in the hospitals and in the chemical industries, chemotherapies, radiotherapy, noise. So we are really, really bad at health care from that point of view. But we cannot go to zero straight away. And also we hit the environment, and we're just feeding the cycle. The environment gets us sick, we get back again. So what's your personal view about how we can make health care sustainable?
While you're talking about this environment, like the question is saying about, in a lot of pharmaceutical industry, a lot of pollution is happening. And if you see the industries which is using their water and discharging their water into that river, and when that is going to the river and people are cultivating their fruits and vegetables in the river, and the same kind of water drinking into their body. So first we have to eradicate the kind of pollution which is happening in the industry. Second point is that whatever the rejects or whatever the waste is coming out of the industry, that should be properly treated. One of the major things is told about your disposal of different kinds of plastics also into the environment. You know that during COVID and pandemic, a lot of things has been, biomedical waste has been generated. Actually, nobody knows what exactly goes the biomedical waste. Whether it has been disposed of properly or not, nobody has that kind of data. Tomorrow, you don't know, if the dispose is not done in a scientifically way, tomorrow it might lead to another kind of a virus, you don't know. So, kind of an environment, whatever the kind of a dispose you are disposing from the industry, it should be treated in the scientifical way so that the hazards should be minimized and should not affect to the environment or should not affect to the water body. So proper disposal mechanism. In that ground, I can say that in the last 3 years, I'm working in the kind of a waste management in India, and people knows me in India as a working in many of the waste management, and particularly in terms of plastic waste management declare. So whatever the plastic is generated from the industry, that is properly disposed of and going to the recycling industry, all the co-processing industry, so that the virgin plastic will reduce and the carbon footprint will reduce from the atmosphere. When the carbon footprint is reduced, that means environment moves to be more in a friendly way. That's why I know this first part, if you've taken care of this system, I know the India is going, and the entire world is emerging, if you the lot of developed countries, the very good healthcare systems. But when you are talking about healthcare system, it is not that affordability of many of the people. When you are talking about healthcare system, it should be affordable, it should be easily accessible. So for that reason, we have to find out new technologies, new things, and should be cost minimizations. Okay. So for that part also, healthcare systems plays an important role in terms of a sustainable environment.
Okay, thank you very much. Vikas, I'm going to ask you a question. You are into ecosystem and optimization. So how could that serve us in this idea? We started with the dilemma. There is partial solutions. I'm not saying there's full solutions. How your ecosystem and optimization come into it?
Yeah, so when you talk in terms of healthcare, we just recently heard Tusar saying about environment. Let me say he was talking about the ecological environment, right? In healthcare, we also have another environment, and that is the immediate environment that we have around us. Now I'll focus on optimization. Optimization is a word which is a very important word when you talk in terms of any sustainability. Whenever you want any process or any product to be in a sustainable mode, there are a lot of stakeholders in the healthcare ecosystem which needs to be optimized. I am being asked at times on platform as to why a particular hospital has not worked or why it is not, because the resources that are created in a healthcare system, it's a service industry. It's not like any other industry where you have a raw material and you process it and you have a finished product. Here, it's a human being, and a human being has to pass through a process of treating them. So there are lots of processes which needs to be optimized. If you think in terms of ecosystem, we all know, apart from we as humans, we have community around us, then we have service providers, we have governments, we have insurance companies, we have regulators. All of them will have to work in tandem, in synchrony, in order to create an optimization so that this healthcare becomes sustainable. I'll just give a 6E concept, and you can just use those E's. The first E is the ecosystem, and the other 5E, one, he was talking in terms of an environment. The other thing is efficiency. So you can use the word efficiency in various resources, and then you would know. So cost efficiency is one, quality efficiency is one. Then comes equilibrium. We do not think in terms of equilibrium. Someone was talking in terms of balance. So that's equilibrium. So we need to achieve equilibrium. Preventive health care has to be in equilibrium with therapeutic health care. It cannot be only therapeutic health care and no one is focusing on preventive health care. Then comes energy and effectiveness. So energy always, we live in this galaxy which is all energy. Even the healthcare is energy. So there are people who believe in energy. So it is the energy which has to be optimized. And it is the effectiveness of all these processes or the products that are going to be in the healthcare system, which again needs to be optimized. So these are the six E's For a simple formula which you can use using an optimization principle, you can put them to different stakeholders, and then you will start to get solutions to the challenges that everyone is facing in healthcare.
Great. I can add another E, which is excellent. Thank you. Hashimoto. All right. So we just would like to see your views about things. Was relevant to your background, because you've got a very interesting background. So can you tell us what you think about the sustainability in healthcare?
Okay, thank you. I'd like to more focus on the human side, or can I say people side, because everyone in this conference room is belonging to the medical and healthcare industry. They're inventing new technology and a new healthcare system, and it's really great work, and I respect all of you. But may I talk about the people who is not belong to this industry?
Yes, I'm sure.
So, like me, I'm coming from the media industry, and I studied chemistry in my university, but not studied in medical things. And in Japan, the medical doctors and dental doctors are 0.34% in the whole populations, and healthcare providers, including these doctors, are just around 2.0%. And you know what I mean? 98% of people in Japan is not belong to the medical and healthcare system. It means 98% people don't know many things about the healthcare system or these kind of literacies. So if you make a very, very impressive innovation in this field, and maybe it will work very much and help people's life very much. But let you think how people understand the value of the innovations. How? They don't know much about the healthcare's knowledge. How do they know the value of the innovation? No, they can't. So my point of view to sustainability of the healthcare is the key point is improving the people's health literacy to understand the value of the innovations. So the question is, which side we are standing for? Standing for the medical industry or standing for non-medical industry? No, we should stand for both sides, the medical industry and the patient side, and not only the patient side, and not every people. So that's why we need to improve the health literacy, right?
Excellent. Actually, the idea of health literacy and health education always played a big role into sustainability of good health, because we talk about universal. I mean, most of us here are fortunate to be coming from systems where there is at least human level care. I mean, like there are certain areas in South America, in Africa, or even in some parts of Australia that just hand washing and fresh water are good enough. So absolutely, yes, it comes within. Actually, they say that the eye can see what the brain sees. If you cannot see it in your brain, you cannot see it with your eyes. And if you don't have the knowledge, you cannot go for it, which is very good. This goes back to a combination of a lot of things: knowledge, community, education, finance, and everything. The Israeli experiment is very interesting. Would like you just to give us a little bit more about healthcare at home.
Okay, but let me answer first to what you said. I think the main thing is to flip the pyramid. And what do I mean? Sustainability can be when you put your investment, money, innovation in preventive medicine and not in therapeutic medicine. Therapeutic medicine is in many sense in the top of the pyramid of what we're doing every day, but at the end of the day, if you prevent the disease from happening, you eliminate problem of sustainability. So that's what we have to do, to go from therapeutic medicine to preventive medicine as a concept, as startups, as everybody's trying to get another flip of an ECG that I will know with digital medicine. They're putting million in there. Put the million in preventive medicine. When I was a medical student in Burjeel, 1982, what I did, I took medical students and taught them to go to school and to teach health education. This project is working all over Israel until today. Each of the students get a grant so he can do it. And it starts with education. It starts from the kindergarten. And when you prevent the disease, you are completely sustainable. And that's, by the way, on the other side, we do in a hospital at home. One of the growing issues in hospital at home is palliative care. And what is palliative care? We have about 1,000 people now that we are treating at the end of life. And what we are trying to do there is to convince the oncology, stop treating the patient. Stop using pharmaceutical things. Stop giving chemotherapy. It's the end of life. They don't stop, never. They use technology, they use PET-CT, whatever. But sometimes you have to stop treating. You have to be there to hold the end. So those are the things that we have to take in mind and to start changing. That's what we're doing.
Actually, it's good. We know that it's not a movement only in Israel, but since you mentioned palliation, there is hospice at home, which is quite common practice. We had a lot of people did not come to hospitals, but they're treated at home during the COVID time.
Yeah.
Hospitals were empty, almost.
We treated a lot of people in COVID
mortality
time.
rate did not go up if you take COVID out and car accidents, so just dropped down. Yes, it's got some point, but also the idea of education and preventive medicine. Why people are not chasing up preventive medicine? Because there is no money in it. Why should I do an app that prevent disease? Who's gonna buy it? But if I had diabetic thing, a lot of people will buy it. This is simple thing. Every startup wants to be a unicorn.
Yeah, but this is investment in humanity, in infrastructure. This what government has to take in responsibility to change the pyramid. This is the investment of any government in the world that they have to do, to invest in preventive medicine, to start to do it with large money. It's true. It needs a lot of money.
I tell you, I'm from the UAE here. This is easier said in UAE and it's practiced. UAE is pushing for health education, preventive medicine, vaccinations, old age care, exercise, loss of weight. Because they have the money. Honestly, we have the money. This is the government. Nobody pays anything, no tax.
Yeah.
They pay from their own pocket. It's easy to say that here. But the minute we get out of here, it becomes a burden because the government says like, oh my God, how much of the GDP want us to put for health? The private sector have to jump in. And the private sector said, yeah, we're private because we want to make money. Okay. There is a little bit of an argument there that people are not truthful to the cause.
So let me tell you about the cost. In our services, people pay zero money. Nobody pays us. Why? We show the government, the insurance company, the HMO, the stakeholders, that we are doing it much, much cheaper than being in the hospital. So that they're saying, take the money, do it.
Oh, you're a good guy. UAE just acquired 25% of one of the biggest health insurance companies in Israel.
We're talking with the man.
Yeah, so he was the man. So it's good. UAE made money now, straight away.
So
It's good. All right.
Can I add something
yes.
to what he said? Because I work a lot on longevity, and since he's talking in terms of preventive healthcare, there's a different way to look at it, sir. How many of you in this hall would want to live 80 years, where first 40 years is not having any disease, and the next 40 years is what you have to live with disease? How many of you would want to live that way? Can you think of a life where you have all lifestyle diseases, and these lifestyle diseases come to us at a very early stage of 40 years, 35 years, and this lifestyle disease is a huge burden. It's a socio-economic burden and a challenge to the sustainability of the healthcare systems. So what he says, preventive healthcare is where the humanity has to look at. The stakeholders, the government, the global leaders have to look at it. Even if there's no money, if you really want the mankind or a humankind to survive disease-free, first thing is we have to focus on prevention.
This is what I was looking for. Not individualistic thinking. Think as you're part of the human pool in planet Earth.
Yes.
See it from outside. Sit in the moon and look at planet Earth. This is home for everyone,
Yes.
for every human, for everything that lives on it. So it's our duty all to look into it. I mean,
Planet, people, and profit. All three have to be in equilibrium,
Together.
as I rightly said. It
Oh,
cannot be only profit.
I pulled him out of profit, he went back to it. Okay. So, I mean, I think that we had some nice experiences and point of views. This is by no chance, okay, an answer to all what we call sustainability. This is why we're having more and more talks about it. And it seems to be like the whole meeting is going around sustainability and health quality of care and how to cover the ESGs around and go for the UN Sustainable Development Program aims in generality, which is quite exciting things. We have few minutes, and I think that if there is any challenging questions, please come up with it.
Let's give him a round of applause, please. We had a great panel. Dr. Ahmed, great panel. And we do invite you up to the microphone. So who's taking those steps in to come get a conversation going here on stage as we're streaming live Health 2 Conf? Anyone for questions?
You can ask questions. We're not going to ask you a question.
You won't answer them? Sustainability, anyone dealing with that in their business that wants to address or even share their experience? Because this is an opportunity to share. Anybody going once? Oh,
all right,
coming up. Thank you for the courage.
Hi.
Mic's on.
Thank you. Thank you for that very interesting talk. And I know that sustainability is an upcoming topic in health. I'm a co-editor-in-chief of the International Journal of Digital Health. And I'd like to ask, is there any way, or what are your insights with regards to sustainability in terms of health data? Because as we all know, we are moving towards big data. We're collecting data in wearables with all sorts of AI systems. But, in 5 to 10 years' time, nobody has really come up with something that's sustainable for data. So what are your insights on that?
Oh.
Can I answer that?
Yes. I'll follow you, don't worry.
That's a very good question. Data basically is an information, and in healthcare, every individual is generating information of their own body in a very dynamic way, right? The whole idea behind aggregation of this data is for the purpose of analytics, where you can bring an inference or a research or a study which would be for the betterment of the mankind, So the people who are working on a digital platform, who are working on data analytics, who are wanting to aggregate all form of healthcare information data, the sustainability, the key thing would be if you are rightly going to use that particular data. First is that the data has to be like it should not be, it should not be revealed. It has to have some form of a way in which the people whose data is used, they don't feel insecure. There should not be data piracy, but it should be used in the manner which is good for the mankind. And then only it will be sustainable. Otherwise, people are going to avoid other people who want to collect that data, aggregate that data, and work on it. There's a business model that works on data, and that's exactly the reason why it faces challenges as far as data analytics is concerned.
I'm working on big data, right?
Yeah.
So you don't need all that type of data, but from time to time you need to integrate new data sources to understand if those data sources are important or not. So as more and more data gets generated, don't worry too much. You don't need to store and use all the data, but you need new forms of data from time to time to assess how you modify your models or if you can get new insights. And after you continue to focus on only what is most important, as in future you wait for other data sources that you will have to test from time to time. Discard all the rest. Right.
Good. I mean, these are experts in the area, but I tell you from clinical point of view, health system have got one of the most robust and the largest data about anything in the world. Each and every patient went to see a doctor, there's a data, whether it's stored or not. And data is now became the root for innovative work, innovations. AI is coming. We need to know, study the pattern, know what's going on, predict the future. And all these things are data linked. Yes, there is strong regulations about data, leak, usage, what is for, things like that. We have to streamline it properly. But there is no data loss. Most of the time, we have a storage of about 40 to 60% of the data in the world properly stored in digital system. Now in the cloud, we are using Azure, we're using Apple. It's there. People think about using it in AI system for analysis. People think about monetizing it. Okay, to sell it to whoever wants it in the pharmaceutical industry to study things on it. This is not the issue. The issue is we're having something that we learn from. And we know the behavior, and we can predict the future, and we know how to prevent things before they happen. And we know how to manage things when they happen. So it is there. It's not only for finance, not only for fun or apps. It is there for the future of humanity. And I think we are doing a good job with it. But you have to relax a little bit on the restrictions. We have to use it as a human owned information rather than special sector closed up. I think that I've got a big sign here that says time's up. Thank you very much for your listening and supporting us, and welcome again to the conference, and I believe that we'll carry on for the rest of the days. Thank you very much.
Thank you, all of you. Thank you.
Thank you, panelists. Incredible. Thank you very much, Doctor. It's great to have you guys here. If we can ask you to stand up to the stage so we can have a photo. That's a roller mic. Yeah. Drop the mic. It's definitely not sustainable. Awesome. What a great session, having all these great experts sharing all their insight to this big issue that we're all dealing with some way or another. Sustainability is a big conversation, and addressing it in the best way possible is what we're here to do. So thank you again. Give him a round of applause. Thank you, Doctor. Thank you very much.